Muscle Doctor, it's Liam here, and today we're going to take a look at the core. And for this anatomy tutorial, we're going to divide it up into 3 units. So we're beginning with the outer unit. We're beginning with the abdominals, which are kind of a part of the outer unit, but they're just sort of there. So we need to know where they are and what they do. So the top most superficial layer is the external obliques. We remove those, and we've got the internal obliques. Those 2 muscles together are going to rotate the trunk, rotate the vertebral column. They're also going to give us a little bit of vertebral flexion with the other abdominals. Internal obliques come off, and then inside we've got the rectus abdominis. So this is the 6-pack abs. This is the one we think of when we see the abdominals. This makes up the abdominal portion of the outer unit. So for the rest of the outer unit, we're going to need to look at the posterior lower back. The posterior section of the outer unit consists of the erector spinae. So the erector spinae, they're on the back, on the posterior spine, and as they shorten and contract, they extend the spine. These consist of 3 different muscles. So we've got the iliocostalis. This is the most lateral of the 3 muscles that consist of the erector spinae, and it connects the ilium to the costals, or the ribs, iliocostalis. Second one that we've got moving more medially is the longissimus. So the longest, as would be indicated by the name, and this can be divided up into its different sections. So we've got the cervical spine, the thoracic spine, and the lumbar spine. So we'll have longissimus thoracis would be in this section here, longissimus cervicis, so on and so forth. And then most medially, we've got the spinalis section of the erector spinae. So these 3 together, they can be memorized with a helpful mnemonic of I, long for spinach. I, iliocostalis, long, longissimus, and spinach, spinalis. So these 3 muscles, the erector spinae group and the abdominals of the anterior and lateral side, consisting of obliques, internal, external, as well as rectus abdominis, make up the outer unit of the core. We've also got the fascial slings. They're a topic of conversation for another time. So we've removed external and internal oblique and also rectus abdominis. So now we're down to the transverse abdominis. This is the deepest layer of abdominal musculature, and it's the first part of the inner unit that we're going to look at. When we think of the inner unit, let's try and think of a drum with a top, a bottom, and an outer skin. So if that's the case, transverse abdominis makes up the outer skin of this drum. And it doesn't just stop where it inserts onto the linear elbow, which is the kind of zip where the umbilicus sits, but also goes around to the side and comes very, very close to quadratus lumborum. So easily forgotten about, try not to. It does come underneath there. It sits deep to the internal and external obliques. Not to be forgotten about. That's the outer skin of the drum. Then we've got the top of the drum, which is the diaphragm. So the diaphragm, big muscle. It's got a central tendon that it all kind of inserts into from its origins of the lumbar spine, of the ribs, of the xiphoid process and sternum. It's like a parachute. And as that contracts into the central tendon, it draws down and it creates a vacuum within the thoracic cavity, which then draws air in. Its primary job is inhalation. If it's not working properly, then the accessory muscles of inhalation are going to start to kick in. So all the things that connect onto the ribs, serratus anterior, pec major, pec minor, muscles that you often see overused with people coming into clinic with neck and shoulder problems. So keep the function of the diaphragm in mind. Are they using it adequately and appropriately? The third and final part of the anterior inner unit is the pelvic floor. So pelvic floor, there's a lot that can be said about the pelvic floor. 2 muscles in particular that we're thinking of here, which are levator ani and iliococcygeus. What do we need to know about pelvic floor? Well, there are pelvic floor specialists out there. Essentially, it contains the visceral contents, I think is its official action. So this is something that we rely on to work in harmony with the diaphragm, with transverse abdominis, and the inner unit of the posterior spine, which we'll talk about momentarily. Those 4 elements need to work together to compress the abdominal contents and to give us what we call intra-abdominal pressure, which is the pressure that we need to support the bony structure of the spine. You only have to have seen strongman contests, powerlifting. You've got these big, strong guys. They've invariably got these big guts. Yeah, there's a lot of visceral fat in there, but a lot of what you're looking at there is also abdominal and core musculature, which enables them to bolster their spine and gives them more strength. For the posterior side of the inner unit of the core, we've got the misses group. So these make up the kind of zip of the rest of the inner unit that we've talked about up to this point. Misses group, M, R, S. We've got M, which are the multifidus or multifidae, if you're talking in plural. These connect one spinous process of the vertebra to a transverse process of a vertebrae a few levels below. So these muscles help to rotate the spine. They also give us some support and some integrity and strength to the bony structure of the spine. That's M. R, we've got the rotatories. Very, very similar structure and function, although this time instead of going from one spinous process to a transverse process a few vertebrae lower down, they're going to go from the spinous process to the transverse process of the vertebra below. So you can start to see now this web and this scaffolding of soft tissue and muscles that are giving the unsupported spine more strength to its structure. The S of the Mrs. group is the semispinalis. So a bit more of a niche muscle. You'll find this one slightly higher up the thoracic spine into the cervical, and this is on the posterior spine, so it's going to extend the spine when it contracts. So onto the deepest unit, the deep unit of the core. These are the muscles that are at the deepest layer. So they're going to connect one bony prominence of the vertebra to another. These are the true scaffolding of the spine, and I think it's recruitment, activation and strengthening of these muscles that are really going to help to increase the strength and stability of an unsupported spine. They say that the bony structure of an unsupported spine can only manage about 4 to 5 kilos of weight. Since that's probably the weight of your head or not far off, we start to realize how much we rely on the tension of these muscles that connect one vertebrae to another. So the deepest layer, we've got the interspinalis. Interspinalis are going to connect one spinous process to another spinous process, and they are there more prominent in the lumbar spine. The next layer, we've got the intertransversarii. So you can probably guess through the name, they connect one transverse process to another, and again are more prominent in the lumbar spine. And the third and final muscle of this deepest layer, a levatores costarum. A wordy name, but break it apart and you can figure out it elevates the ribs. So in a whole category of its own is psoas major. Psoas major, primarily a hip flexor, and we naturally think of it as such, but it does have a very strong origin on the lumbar spine. Really, it should be a posterior muscle, but we can't get through the erector spinae and QL to actually get to it effectively, so we have to go anteriorly with different treatment techniques. It's like the rotator cuff of the lumbar spine, if you can imagine that. It has a big, strong origin there, so we rely on strength and stability and function of that muscle for core stability, especially when it comes to lumbar spine. And the last one that sits in a similar category, which is miscellaneous, would be QL. Quadratus lumborum connects the posterior iliac crest to the last rib, has again a big strong attachment point on the transverse processes of the lumbar vertebrae, and it actually sits, as you can see in the diagram here, very, very close to the psoas. So dysfunction in one of those muscles can be affected by dysfunction in the other. I hope you found this helpful, and if you did, please like, comment and subscribe, and send in some requests. I'd love to know what it is that you would like to see as far as anatomy tutorial videos go. Bye for now.